core technology, I mean the core products that we address or we develop are related to healthcare. So basically we develop end-to-end solutions for ERP solutions for hospitals, and that has been our core business all along, ever since we were founded in 2008. And of late we have branched out into mobile applications, smaller web-based applications, browser-based applications, addressing the different needs of the healthcare sector, such as solutions for smaller clinics, smaller solutions for hospitals, like a queue management system, or plug into their existing hospital information system, things like that. So we have about 40 clients across India, mainly focused in Karnataka, West Bengal and Bihar. And we have a couple of clients in Egypt, and a group of hospitals in Kenya. So that's about my organization and myself in brief. I come with about 20 years of experience in IT, with about 15 years in documentation, product management, implementation in various domains, and of the last 5 years I have been in this healthcare domain. So today I will be talking to all of you about the opportunities in artificial intelligence in healthcare. So as you all know, we have a lot of talk, a lot of small prompted and phrases in all of artificial intelligence. How is artificial intelligence affecting healthcare? That is what is the topic today, and what are the kind of skill sets and opportunities that are available in healthcare, in the artificial intelligence field in healthcare, in the healthcare sector. So I already have two questions over here. One is from Smruti Rekha Das, who has said that she has done her PhD in biomaterial and biotechnology, and she has a career break of 3 years. So what are her opportunities in the healthcare domain? Well, there are numerous opportunities for you, Smruti Rekha, in the healthcare domain, but if you are focusing, today we are focusing on artificial intelligence. So if that is the area you are looking for, then you will have to upgrade your skill sets a bit, where you need to learn a little bit of programming, a little bit of data analytics combined with your existing qualifications, and then you can fit in. Like, you know, you have clinical laboratories, you have biotechnology companies who are developing software for the mainstream. Okay, so or you have biotechnology software development companies where you can seek opportunities with your knowledge, with your you can be a subject matter expert in these companies. And of course, if you are looking at the artificial intelligence part, then you can give in your contribution in the analytics part, where you can study the clinical data that is given and use your knowledge, use your expertise, and contribute towards the analytics part. So why are we focusing so much on analytics? So it is this analytics that helps in making the machines learn, in creating algorithms, whereby a lot of automation happens. Okay, so let us take a very simple case. We have tons and tons of patient data available in the hospitals. Okay, so doctors on a daily basis, they write their diagnosis, they write their prescriptions. Okay, Sometimes it is e-prescriptions. They use a digital system, they use a system and they write their prescriptions and diagnosis. Sometimes they use handwritten manual written notes which are scanned and uploaded. So now if we get access to this kind of data, there's a lot of analytics. People do a lot of analytics around this data. They sort the data in such a way that you have similar kind of data all grouped up, and similar kind of symptoms, patient symptoms, and the diagnosis around that, and the prescriptions around that, and algorithms are built into software, into systems, whereby when a doctor sits in front of a system and is diagnosing a patient with similar symptoms, the symptoms are auto-suggested on a system, on the prescriptions are auto-suggested, the diagnosis is auto-suggested. So that is where artificial intelligence is making a difference. Okay, so in this, when things are auto-suggested, there's a lot of time saving. There's a lot of time saving that happens. So the patient care becomes more, what do I say? You get more time towards caring for the patient. You can give more time to the patient when you are spending less time writing the history, writing the diagnosis, writing the prescriptions. You can give a lot more time to the patients. Okay, so that is one area. Okay, so this is where artificial intelligence, and now we have, so I don't know how far you can contribute towards this thing, but if you towards the analytics, but if you can upgrade your skill set a bit, a little bit of programming, a little bit of data science, and then I think you are fit for the industry, for the healthcare industry. The second question that I have on my screen here is from Neha, and she says that she has done her MTech in power electronics. So do I have any scope in the healthcare segment? Okay, so I am really sorry, Neha. I did a lot of research on your qualifications, and in the healthcare segment, I have not really found any scope where you can contribute. But again, like I mentioned to Smriti Rekha, if you are able to design systems, if you are able to do a little bit of robotics with your knowledge, if you have knowledge of robotics, then you can contribute to the healthcare sector in a great way. Why? Because artificial intelligence, again over here, is playing a great role in artificial intelligence in creating these automated surgeries, automated, like you have something called telesurgeries, which the technology is moving towards that, whereby the robots will do the surgery based on the complete programs, algorithms that are fed into the software, that runs them, and then a lot of the processes will be automated. So if you have programming knowledge, if you can contribute towards that, then I think you will be a right fit in the industry. So artificial intelligence, again, in healthcare is creating a lot of job opportunities. So some of the areas which I will just touch upon. So in the meantime, Shweta, can you let me know if there are any other questions that have come, because I don't on the screen right now. One more question which says from Arpita, with the scope of AI has created so far in healthcare sector in India. Okay, the scope of AI is huge, and how many jobs, I really don't have the numbers with me, but I do know that it has started creating a lot of jobs in India, and some of the areas where the jobs are getting created are as follows. If you would like to note it down, okay. See, we have if you have robot assisted diagnostics. Okay, so robots and machine learning are being integrated in the actual physical robotic model to perform diagnostics. Okay, so here you have to simulate the design for which experts will be in high demand. Okay, so robots can handle the initial level of disease diagnosis and detection. So you are seeing that there is a complete shift from manual diagnosis to robotics, okay, to robots. Okay, so once the diagnosis is complete, the information is passed on directly to the concerned department through the automated processes, enabling doctors to devote more time to provide personalized care to patients. Okay. Another area where we are seeing a lot of artificial intelligence being developed, I was just telling you that software developers are using artificial intelligence, using patient data, diagnostic data, clinical data, electronic health records to create algorithms. Okay, so if you are good in data science, if you have a good knowledge of data science, then you can be contributing towards this area to create these algorithms, whereby these algorithms are fed into the software program, and everything that is right from the diagnosis to the prescriptions to the consultation, that is after post consultation care, all of that is taken care of by auto suggestions. So there is absolutely no manual intervention, or the doctors don't really have to sit and think for every patient. So you have a similar kind of patients coming in, or patients with similar symptoms, you can use this these algorithms to treat them. Another area where again we have artificial intelligence playing a great role, another area of employment or job opportunity is if you are a good UI UX designer and you are a design thinker. Okay, you can have a great opportunity over here, because what happens is when you are creating software or creating programs for the doctors or for the hospitals or for the clinics, for healthcare segment in general. Okay, if you have the problem solving skills, and if you have good knowledge of the processes, healthcare processes, hospital processes or clinic processes, then what happens is you can contribute towards designing software, designing robots that can help in doing the diagnosis. Okay, so I hope I have answered your question. So as far as the numbers, I really don't have, different sources give different numbers, but yes, job opportunities are being created, but again you will have to very specifically apply to companies which are specializing in healthcare software development, or for whereby artificial intelligence have. So there is another question which has come up which says, I have experience in Oracle DBA. What are the trainings to go through in order to change my career in AI? So since you are already a database administrator, so I'm sure you will be an expert in writing queries and extracting data from the databases. Okay, so here what we have is we have tons and tons of patient data. So the different analytics around the patient data is where you need to specialize. You need to learn a little bit of analytics and you know how to generate the business intelligence part basically. So how to generate the different kinds of report, the different trends in the various areas, trends in, say for example, trends in the disease management. Okay, so supposing you have a sudden rise in dengue cases in a particular hospital. So every patient will have records. I mean the physical records of the patients will be maintained, their symptoms, their this thing. So you can you should have the expertise to study that kind of data, analyze the pattern, analyze the diagnosis around that pattern, and then create a program, okay, which can be used when a similar situation arises. Okay, for example, we I mean today's current day scenario is this coronavirus which is going around. So we have now millions of patients or thousands of patients being treated, okay, for coronavirus. So everywhere their symptoms are being recorded, the treatment that is being given to them is being recorded. So it is a certain pattern that they are following. So now when all this is recorded in the database, you should have the expertise to extract this data, study the pattern, study the trend, and then develop a program or an algorithm around that. So the next time a similar kind of virus attack happens, so you know exactly the area of diagnosis, the area of these prescriptions or this diagnosis will be auto-suggested to the doctors. So this is the I mean you should definitely undergo training in data science. There are a lot of courses available now. So and then you can be a good contributor to you know, developing algorithms in artificial intelligence. So if you have any other questions, please feel free to reach out to me. I'll be happy I can have answered them. So we have a question. Is there scope for people like me who are completely non-medical professionals to get some kind of technical job in the healthcare sector? Well, in the healthcare sector is a niche sector. So you should have some kind of basic training to understand the healthcare processes. Okay, so whether you take up a job in a diagnostic center or whether you take up a job in the front office of a hospital or anywhere, okay, you should have some basic understanding of the hospital processes, and then you can easily fit in, and it will be good. Nowadays there are a lot of courses available for hospital management, and I've seen people having done their masters in hospital management. Okay, so that's where you learn the complete know-how, and once you get the know-how, once you understand the flow of how things work in terms of a digitalized hospital, okay, where everything is electronic, everything is how the workflows happen in a hospital, right from a patient walking in to the diagnosis to the tests to the investigation processes, and then the final prescription and the consultation form being generated by the doctors and the patient walking out. And not only this, the other areas of hospital management such as procurement, managing the stores, managing the back-end processes, all of that. So you should have some basic training around that, and then you can get a job in the healthcare sector. Another is that all for the questions? I mean, I think I've answered most of them. So if you have any other questions, do let me know. In the meantime, let me just give you some of the areas where artificial intelligence is making a breakthrough in healthcare. Okay, so like I said a little while ago, we have telesurgery. Okay, so the demand for robo-assisted surgeries is going to grow manifold. Why? Because telesurgeries are, what people are expecting artificial intelligence to do is to give precise data, to bring about some precision and accuracy in handling certain operations that were being manually operated. Okay, so but finally we have to realize one thing. Everywhere there is human intervention. Even to build the algorithms for artificial intelligence to be inbuilt in these equipments, it is a human intervention, and it is open to errors. Okay, so but however, what people anticipate, what scientists anticipate, is that the number of errors will be reduced when we are dependent on machines, when everything is automated. So we are going towards automated surgeries. So I don't know how many of us would be comfortable going under a robo for being operated. I definitely wouldn't, but that's how the trend is. Okay, so the demand for surgeons, so the demand for specialists to handle these robots will increase. So we will also have a lot of doctors. We will have to work with a lot of doctors in order to even develop the way the robots function. Okay, so if a robo is going to take the role of a surgeon, then we all obviously have to work with surgeons to make sure that everything is precise. Okay, so this is one area which is coming up. The second one I had already mentioned, robotic robo-assisted diagnostics. So everything will be automated based on a certain pattern or based on a certain way of doing things, and this is just to enable the doctors to devote more time towards patients. Okay. Another area where healthcare companies need algorithms is deep learning. Okay, so algorithms that can help them with medical decision making and also determine how healthcare is organized and how health insurance is determined. So all around hospital processes, if you see that. Okay, and another area that again I forgot to mention was predictive analysis. Now, supposing we have a hospital that specializes in cardiology, and we have similar kind of cases, cardiology cases, people with heart attacks coming in, and if there are if there is a certain trend that is identified in the people, okay, we can develop algorithms and programs around that, and the doctors can come up with predictive analysis. Okay, so if this is what you are facing, this is the kind of symptom you are facing, this is where you are heading to, and you can prevent this. So that is where artificial intelligence plays a big role, predictive analysis, and a lot of research and lot of work is going on in that area. And companies are looking for highly skilled data scientists and deep learning experts to realize this vision. Okay, so and we also have chatbot medical based chatbots that can analyze symptoms. Now, supposing a patient, now everything is going online, so patients are going to be talking to doctors online. Now, obviously, we cannot expect a doctor to be 24/7 holding an app or holding a tab and talking to you, right? So this is where we'll have our artificial intelligence coming into play, where we will use AI to design the chatbots, and these chatbots will give you auto suggestions. I mean, they'll ask you questions, and based on your answers, there will be certain prescriptions or certain action points given by the chatbots. So that way, you don't have any manual intervention, doctors are not disturbed, and at the same time the patient gets the complete attention, okay, that it needs from a hospital. So that is one area where a lot of headway has been made. I do not know how much of it is being applied in India, but definitely abroad there is a lot of dependency on mobile applications and portals or things, people going online. So we have a lot of access that is done by the patient. Patients would like to access their data anywhere and everywhere. So a lot of research is going on abroad on all this. Okay, so that's all I have. That some of the areas that I have covered. So if you feel that you have more questions, or okay, so I have one last, okay, I have a couple of more questions here. Okay, so one is, what can be the opportunities for engineers who are passionate about health industry? What jobs are available to them? Do they need to upskill with any courses or certifications for this industry? Well, my answer to that would be that yes, there are opportunities for engineers who are interested in healthcare or in the healthcare industry. So if you have good programming skills, and if you are having good analytical skills, then go join any organization that is developing, that is into healthcare software development or development of equipment related to healthcare. Please go join, use your knowledge there, go join there, join as a trainee, take all the necessary skills, because what I personally believe and what we believe in our organization is that no one comes with a predefined set of skills that are needed for the industry. Every day we have to upskill ourselves, we have to upgrade ourselves. So we are also learning on a day-to-day basis. So just come, join an organization, learn the processes, learn the nitty-gritties around healthcare sector, and then start delivering. So if you are passionate about the health industry, then and you have the basic skills, computer programming skills, then I think any organization which is into healthcare, in the healthcare segment, healthcare IT especially, will definitely love to have such engineers. Courses or certifications, I am not a person who really vouches for certifications or courses, because nothing is defined. Okay, so every day things are changing, everything is very dynamic, so you have to keep learning on the job. So you cannot say that okay, I have a certificate in hospital management, so I come with that. That will be just a standard course, but every day, every hospital, every clinic, every patient is different. Okay, so you have to keep learning on the job. And then we have another question where from Jaya Garg. I am a woman on a career break due to motherhood, but during this break I have completed a one-year program on data science and AI from a reputed institute. Okay, before the break I have 9 years of experience in mainframe technologies. I am looking to join back to work now, and is it possible for me to get jobs in ML and AI? Yes, definitely you are on the right track, Jaya. So though you have, I mean, you already have 9 years of experience, so no experience goes waste. Whatever you have learned in mainframe technologies, definitely it has given you certain skill sets to perform. And since you have already taken a program, you have completed a program on data science and AI, so you will definitely know the trends, and you will definitely know what kind of jobs are available, not necessarily in the healthcare segment. Today I spoke about healthcare because I am from that segment, but the artificial intelligence is being used in almost every sphere of life, and you can definitely give your contribution there. There will be organizations who will be willing to take you and give you a break. So we have last question that we can take today. So Arpita Banerjee, and she says, I have more than 9 years of experience in IT. Have recently done a course on data science. What are my work from home opportunities in healthcare AI? Okay, so work from home opportunities may be very less, Arpita, to be very frank, because this entire artificial intelligence itself is a very new area. I mean, just about 3-4 years old, and everybody is learning, and it's a highly competitive uh, area also. So if you have done a course on data science, you can definitely apply to companies, and if they are willing to let you work from home, I mean, there's nothing like it. But I always feel that, you know, we are limited in our learning when we work from home, because there's a lot that we learn from our peers. There's a lot that we you know, see around us when we are working in an office atmosphere. There's a lot that happens, a lot of discussions that, you know, even coffee table discussions, or you know, tea time discussions. A lot of people discuss the profession, the technology. So, you know, you miss out on all of that. And to keep abreast with the opportunities, or to keep abreast with the industry, you will have to, you know, it's better that you work from an office. And since you've completed your course in data science, and there is a lot of demand for data scientists these days, not only in the healthcare sector, everywhere, in many of the sectors, there's a lot of demand. So I think you have a good opportunity there. And since you have 9 years of experience already, definitely you have an advantage. Okay. I think I have one line, Shweta, and after this wrap up. Okay, so there is interesting question, which are what are the disadvantages of technology in healthcare? Any safety measures are considered while handling advanced technologies in healthcare like AI? Yes, there are a lot of disadvantages. Like I said, we cannot completely depend on robots and machines. Okay, and since robots and machines are equipment are developed by human beings, we have to give about 10% you know, space for human error. Okay, though most of the you know, quality checks, or you know, testing that happens around these kind of equipment, they will make it as precise as possible. But yes, that is one disadvantage, is that it may not be 100% precise. And finally, you know, we are dealing with patients. Okay, and patients are human beings, and every individual, every human being has a different biological structure. So what works for one may or may not work for the other. Okay, so yes, there is a disadvantage. And another disadvantage is when we are trying to automate everything, there is going to be a loss of jobs as well. Okay, if we are going to go towards telesurgery, or if we are going to go towards robo diagnostics, okay, so we lose a lot of you know, jobs over there. But then again, it will create a lot of jobs for data scientists, for analysts, for programmers who can write good algorithms. So the balance is created there. Okay, and safety measures is one thing, is we are dealing with patient data, which is highly sensitive data. So we have to have certain regulatory measures, or we have to follow certain regulations. I know that in the US, the HIPAA standards are imposed on every company, every healthcare company, or every company which is dealing with patient data. But in India, unfortunately, we do not have such regulatory measures. Okay, and sadly, patient data is freely available. Okay, lot of analytic companies are buying patient data from software companies, from hospitals, and because there is a lot of money involved, things are, you know, openly available in the market. But that is not the way it should be. But you have to be as precise as possible. So safety measures, people try to do as much as possible, but then we have to you know, always give that 5% or 10% space for human error, because finally it is human beings who are doing everything, whether it is the manual surgery or whether it's a robotic surgery where the robot is designed by a human being. And thank you for those questions. Each of them were very valuable in my learning, and it was an honor to talk to you all. Thank you.